Hi guys, welcome to Instagram Live. My name is Rod Stanley, and I'm excited to be with you today. We're doing a new format, and I want to let, if you can, it looks like we have one person on here, and if you could let me know if the audio is coming through, great. Just type something in the comments here. That'd be awesome. We're streaming from StreamYard today, so the first time giving it a try. Just want to make sure we're loud and clear. And let me pull up. What's going on, Sarah? How are you doing? It's great. Perfect. Glad you can hear me. Sam, what's going on? All right. So let's give it. All right. So today we have a topic about pain, which is great. A great topic. I have so many clients that come to me for a lot of different things, and pain is one of them. I can't think of anybody I've trained recently that that didn't have any pain going on. So it's very common. We all have some type of pain generally, especially as we age. So I've come across a new study that I want to share with everyone, and hope that it can help you with your pain management as well. So let me pull up the presentation here. Cool. So, well, I am Rod, as you know. I do many things. I'm a motivator, husband, teacher, and just help people get in shape and live healthier lives. That's what I'm all about. So today, what we're going to be talking about is pain. So let's go back just a little bit. And this thing is quick. So the prevalence of pain and its origin, and the walk back trial. This was an interesting trial that I found on Medscape the other day. And they were talking about walking and how simply walking could help decrease back pain. And they did a study on it. And it was really awesome. And also new evidence on emotional therapy and cognitive-based therapy and how that can help. And then last but not least, we're going to talk about the mind-body connected program and how that can help, and how I've been using now some of these techniques that we'll talk about today to help some of my clients get out of pain. Before we move on, let me check here on Instagram. Looks like what's going on? Asher House, we got a few people on, but I'm not able to see those comments over there. So we'll just keep rolling. So thank you guys for jumping on today. So prevalence of back pain. Back pain is so common. In 2019, we conducted this study and found that 44% of adults have some type of back pain, and it's really a global epidemic. In fact, back pain is why I started working out to begin with. I was about 19 years old. Just, I don't even know what happened, which is really right up the alley for what we're going to be talking about today, because most people have some type of pain, especially back pain, and don't know where it came from. So more common than in older adults, and the back pain increases with age. So as we get older, we tend to have more and more back pain. A few more statistics on back pain. uh, the economic impact. Back pain is significant economic burden. $200 billion is spent annually just managing it. And this is just back pain. We're not even talking about knee pain, hip pain, shoulder pain. So people are really hurting out there by the millions. So if we can find strategies that are, minimally invasive, not using drugs, that are all natural, that can help them heal, we definitely want to do that. So that's what we're talking about. So low back pain has been a leading cause of years lived with disability since 1990. And that's a crazy stat, right? The number of people with low back pain is increasing as the global population increases and ages. So what is pain? Approximately 85% of people with chronic pain have no known cause of what the pain is. So it seems like today, so many people have pain and don't know what the cause is. And it's no matter what the imaging does, they aren't able to find it. In fact, this book here I was reading, Healing Back Pain, who's a leading chiropractor, when he wrote this book, he stopped referring a lot of his patients to get therapy because they just weren't getting better. They weren't able to get to the root cause of the pain. And if the diagnostic test can't figure out what's going on, there's no real way to know what's going on. Hi, Denise, what's going on? Thanks for joining, as always. So for a long time, we thought that chronic pain is due primarily to a problem in the body. And what we're finding now is not just in the body, that we can do some brain therapy as well to help generate and heal the body, that the body can start to unlearn this pain. And that is what that study was about, that we'll go over in just a bit. So what is pain? Continue. Pain is a multifaceted experience that encompasses both physical and emotional dimensions. And this gets into why a lot of the times we're unable to find with imaging, no matter if it's x-rays, MRIs, what is actually going on. And sometimes the reason why therapy is unable to help, because sometimes the pain stems from something that's emotional and not just physical. So you're not going to be able to get to the root cause if we're only using physical modalities and drugs. So emotional pain can be tied to past traumas, unresolved stress, and that results in pain in the body. So this pain in the body can be from an energetic pattern that perpetuates suffering by maintaining a state of dissonance and imbalance within the mind and the body. So let's go a little bit more. So rather than being an entity, the pain in the body is an accumulation of cellular memory and undigested trauma that influences our perception and emotional states. So a different way to think about it is if something happens to you, your body's either physically trying to retreat or emotionally trying to retreat. And either way, it could cause pain in the body. So we have to be able to address both sides of it in order to get true pain relief. So addressing the pain with acceptance, well, this thing is really fast, such as a release of endorphins, which are the natural painkillers. These are going to be released with movement. So the holistic approach to understanding and managing pain emphasizes this, right? So next, so the first study we're going to look at really quick was a walkback trial. 701 adults were in this trial. All of them had at least 33 episodes of back pain, which is quite a bit and they were expecting them to continue to have that pain. And they were randomly put into a study. And at the end of the trial, these participants who walked at least 3 times a week were able to reduce their pain. And they found that they reduced their activity limiting low back pain through the medium and recurrent a long time intervention. Participants in the control found that they didn't have any recurrent pain for over 208 days. So by designing a program with the physiotherapists that taught these people how to walk, as well as coaching them on how their body could respond to pain, they were able to alleviate this pain and keep it off by doing something just as simple as walking, partnered with understanding how to move properly. So in the next one here, so the benefits of walking, which we know is going to help get the muscles in the hips, the low back, and all these muscles a lot stronger. And one of the things that people tend to do when they get into pain is to stop moving. But that's the worst thing you could do, right? Is stop moving. So we don't want to stop moving. As long as you're keeping moving, your body is going to start to adapt and you can start to recover from some of those pains. So it's the combination of exercise and movement and the education that allow these people to improve. And the question that the doctor had was, could these people continue to do this on their own? Of course, the answer is yes, as long as we learn how to move properly. So the second study that I found was about emotional awareness therapy and cognitive-based therapy. And they found that this is something that we've been using since the 2010, and it's been helping people with their perception of pain. And sometimes this pain is even related to grief and stress and fear. So let's back up just a little bit. And they were able to contrast this type of therapy with cognitive-based therapy, which has been the gold standard up until now. So this emotional awareness therapy is something that was developed by Dr. Mark Lumley, and it's helped people with central sensitization pain and central augmentation pain. So we'll look at what those type of diseases are in just a little bit, but these are very common things like fibromyalgia and other things like that. So this integrates principles from modern effective and pain neuroscience and coding and really understanding what's going on with the body. So here we have it continued. This is something that's been in practice since 2019. A lot of times I talk to my clients about, emotions and how they're feeling about certain things, but because we haven't been really educated on how pain can stem from emotions and how that can have an effect. But the Department of Health has been using this as a practice since 2019. And this can lead to substantial reductions in pain, as well as improvements in the mood and relationships. And it's even more valuable for people who have chronic pain that can't be treated with anything else. So we were talking about the centralized pain earlier. So if you suffer from fibromyalgia, chronic fatigue, myofascial pain syndrome, osteoarthritis, or rheumatoid arthritis, so this might be something that you want to add to your treatment plan or talk to your physician about incorporating some of these things into your treatment plan. I mean, fibromyalgia, if you know anyone who suffers from that, I mean, it can be truly debilitating. Osteoarthritis, I mean, I have a little bit of osteoarthritis. A lot of my clients suffer from it as well. So this type of therapy can help. And so this is just a little bit overview of what cognitive behavioral therapy is. I won't get into deep into what that one is because we know that that's been the gold standard in treatment. So what the study was looking at was veterans, 60 to 95 years old, who had at least 3 months of musculoskeletal pain. 2/3 of these patients had a psychiatric diagnosis, and almost all of them had back pain. Each patient had 90-minute individual sessions with 90-minute group sessions, and they were asked to rate their pain on a brief pain inventory scale. And what they found after just doing this type of therapy, that they had a 2-point reduction in their pain compared to the cognitive-based therapy. They had 30% decrease in reported pain as compared to 17% in this cognitive-based therapy patients. At 6 months, these people still had a 40% reduction in pain, and this just continued to improve over time. So more than 1/3 of the veterans receiving emotional awareness therapy, expressive therapy, reported at least a 50% reduction 10 weeks later, and it just continued on. So it looks like this type of therapy is getting down to the root cause of some of these things, because these people weren't able to be treated with just, drugs or the typical intervention. So I think that's really a great conclusion from this study. So Dr. Tracy Speed, who works with Medscape, says that it was a bit surprising how impressive this study was. And the thing that she said that was really important to note was we're starting to really appreciate the role that emotions play in pain and sensitivity. And I think that's important, because if we're only attacking these types of pains with just the physical modalities, oftentimes we might not be getting to the root cause. And if we're not getting to the root cause, then we're not going to be able to get the help that we really need, right? So my takeaways is a combination of movement combined with emotional awareness release can help with pain reduction. And this is where personal training can come into play, because making sure that you get into quality movement. The patients who were earlier in the first study, the walk away study, they had to work with a physiotherapist to make sure that their bodies are moving properly. And movement is life, I think, right? When we move, it's total body movement is going to stimulate all those, the circulation, the respiration, and it's going to include all the muscles and joints and help to reduce the body tension and the body armoring. And that body armoring is what we were talking about earlier. If there's physical trauma, emotional trauma, our body is either trying to retreat physically or emotionally. And that can lead to pain in the body. So moving your body is going to reduce the chronic pain. Engaging in these physical activities is going to lead to reduction in chronic pain movement. I mean, like me personally, these days I work so that my body feels better. I've noticed that if I go 2 or 3 days without working out, I'm going to have more aches and pains than I would if I'm working out. Which most people who haven't experienced that, or if you're someone who doesn't work out a lot, that might not seem like it makes sense. But if your body starts to crave and feels better once you get moving. So emotional and psychological benefits. Movement is going to help you reduce depression and suicidal ideations. Physical activity can enhance the mood and increase those endorphins. And last but not least, getting rid of those suppressed emotions and trapped energy in the body is going to lead to emotional release and improve mental health, which is also going to help you feel better. So what kind of movements should you be doing to actually feel better? You know, there's so many different types of movements you can do. I know we all know that yoga, that's what comes to mind most of the time for people when you're talking about, relieving physical stress on the body and making your body feel good. Stretching and yoga definitely comes to mind because you're going to get the oxygen and blood flow, which is going to help relieve, tension, and it's going to help the body feel a little bit better. Tai Chi and Qigong is also really great. It's going to help move energy throughout the body. And if we're talking about emotions and those type of things, it's trapped energy either physically in the body in the form of tight muscles, or when the hormones, the neurotransmitters and those type of things are off, it's going to lead to trapped energy in the body as well. So those Tai Chi and the breathing exercises are going to help with that. And what else could you do with that is meditation and mindfulness is also great. Free form dancing is great. Any type of movement that you can do generally is going to be helpful for reducing body pain. And this next slide is resistance training. We often don't think about weight training or resistance training as a form of pain relief, but it can help reduce pain because it's going to remove stagnant energy, especially when you're doing a lot of functional training and total body movements, which is what I like to do with a lot of my clients, especially with those who want to have better movement. And that's going to help relieve the tension throughout the body and get the energy flowing again. So I like to see personal training and resistance training, elevated in the sense that it can be right up there with the other modalities such as yoga and things like that are known to help relieve some of the tension within the body. And if you're doing a proper program, it's and working on each joint throughout the entire body, working on the ankles, the knees, the hips, and creating more movement, that's going to help further facilitate getting that energy, that trapped energy moving throughout the body. So education on how the body and biomechanic functions. I think I made a mistake on that one, but with personal training and working out, it's important to know how your body should function. I get a lot of people in who are unsure, for example, that their foot should move up and down, or, how their shoulders should move, and, using that full ball and socket and how that should work, and the hip and ankle. And without that type of education, it can be a little bit more challenging to find ways to relieve tension and pain within the body. And then also having mindfulness in the movement. So not only should you have a program that's going to get the right movements in your body, you want to have one that's going to teach you which muscles are working so that you know how it should feel when you're in those certain positions. So that's hugely important, is really understanding how your body should work. So with the Mind Body Connected program, which I'll show you just a few slides of it here, it incorporates all of those movements into each one of the workouts. So first up is working from the feet, the ankle. Then we work with the hips, the knee, and the spine, and making sure everything is working in working order throughout the entire body. We can't see it on this clip, but also the trunk, and making sure things are moving within the trunk. And when your body is able to move freely at all joints, now you have the energy able to move throughout the body. And I created that program with this in mind. And the reason why I did that, because I had to go through this entire journey myself of rebuilding my body from the ankle all the way up. And I wanted to create a program that would allow me to bring the best of what I learned throughout that on-the-job training of rebuilding my body in that way, and pass that on to anyone who is looking to ease themselves of pain and feel a little bit better. So this is week 4 of the program, where we start to move from, what does this thing keep jumping on me? From some of the individual joints into more of a strength-based workout. And it just follows suit from there, weeks 4 on through week 12. And so we start with working with the joints and create a better movement, and then working on strengthening the body. That way, everything becomes connected. You're going to have that awareness of how your body should move at each joint. And then you start working on building the strength in around each joint, so that you start to really feel better. A lot of times, what I've found with my clients is, and myself, some of the things that we experience is as pain is just weakness or an imbalance. And if we can work on strengthening those areas, the pain generally goes away. Now, I had this shoulder injury on my left side for the better part of 3 months, and I just continued to work on it, and work on the small stabilizing muscles, and then working on the prime movers, which are, the deltoids. And over time, I was able to relieve that pain. But those type of things, and really getting to the root cause of the issue, is really important. And really understanding and having that awareness of how your body should move is super important, and will teach you that. Last but not least, nutrition guide is also in that program for helping people improve their nutrition. That's a huge component, because if you're eating a great diet, it's going to help decrease the inflammation in the body, and have cause an anti-inflammatory effect. And that inflammation is also a representation of trapped energy within the body. When things get inflamed, all the body's trying to heal that area, so things are kind of trapped in that area until it heals. So decreasing inflammation through nutrition and breathing as well also helps move trapped energy. All those things are really great when you combine them all together and in a program. So, and the last component of that is kind of working in groups with each other and keeping each other motivated. That's hugely important. One of the things that they noted in that program during the walk was the education and the accountability that was created with the professionals really helped those participants not only feel better, but live better for the long term and stay out of pain for a while. So I've created these groups here that we can converse with each other and keep each other motivated and create that accountability while we're trying to build those good habits. I talked a lot of times to some of my clients about having the intrinsic motivation to do things. And a lot of times we just don't have it when it comes to exercise if it's not something that we enjoy. So getting into small groups, working with other people who are like-minded, who are trying to get to the same place that you are, who are working to be better, that can help. Having that extrinsic motivation can help until you're able to do it yourself, and you're having fun with it yourself. So that's also important. So I want to talk to you about my client, Kim Kate. This thing is like super fast. Tim Kincaid. This guy came to me about a year and a half ago. He's been a client and a good friend of mine. Tim came to me with a lot of pain. He had, as you can see here in the photo, he's unable to get his shoulder all the way, his left arm all the way up. The other arm is unable to straighten completely due to surgeries in the elbow and different bone fragments he's had here in the elbow. And also in that other shoulder, just the nerve damage from falls and things like that. Tim worked in the construction industry for a long time, building houses, and as you can imagine, climbing ladders and dealing with electricity. I think he told me he's been electrocuted a few times. So his body took a lot of wear and tear. And on top of that, he's had dual knee replacements. So Tim had a lot going on when we first started. And as I mentioned all the times on these lives, sometimes I get clients and there's no manual on how to train people with all of these different things going on. And that's why I think it's important to get with someone who can walk you through the process of understanding how your body works and understanding how to create a program that's going to be tailored exactly for you. One of the things that Tim and I have done, he came to me and said, I want to do this for the long haul, Rod. Tim is, I think he was 63 when we first started. He said he wants to go at this thing for, until he's 90, hopefully. Hopefully we'll still be training when he's 90. But he wanted to take the slow approach and really understand his body and how he can move more successfully over the next 20, 30 years, if he's willing to, able to live that long. So, and we took the slow approach and, we did a lot of trial and error. And just like I encourage all of my clients is to learn what works for your body. And as we go along, we found different exercises that were great for Tim. And some of them are very unorthodox. And that's okay. Tim allows me to get a little bit creative with him. And now it took us about 4 months before we were able to really dial into what specific things were going to work for his shoulder, because as you can imagine, there's different imbalances on one side to the other. Tim was unsure if he could even get to a high level of exercise, and we just went to work at it. So as you can see here, I was able to create a custom program for Tim. And it's really made a difference in his life and the quality of his life. He's had a significant reduction in his pain, something that he didn't expect. When I first met Tim, he swore by this stuff called arnica oil, which is really great for pain reduction if you've ever heard of it. And he was, every night he, rub himself down because his shoulder was just in so much pain. Not a lot of stability around it. He just was unsure if he could do anything with it. And all of a sudden, after we had been going along for a while, Tim realized that he hadn't used the arnica oil at that time it was about 2 months. And now I think it's been about 4 months since he's used it. But his only cue to use it was when he was in pain at night. So he wasn't in pain anymore. So he just stopped using it. And so it was just really great that, Tim has let me work with him and help him kind of turn back the hands of time in a sense and create more movement and create a program that's really worked for him. But as I say, it takes time to understand your body, and working with professionals like myself can really help you get going. So that is my presentation. Hopefully you guys found that interesting. It's a little bit of a different format than I'm used to. So hopefully I can get a little bit better with slides and everything to get this a little bit live. So we'll take some questions. Denise says, fear is a huge one. The older one gets, the fear of falling increases. Movement is impacted. Balance gets affected, etc. Hey, Ann, what's going on? Thanks for joining. Yeah, you're right, Denise. And fear is huge. Even in myself, when I went through so many different things about 2 or 3 years ago, every time I went to the gym, it felt like something was going to break, something was going to, hurt. So it can really mess with your mind if you're not, really aware of, how the body works and what things you can get into for yourself to create better movement. Like my client, Tim here, he was a little bit apprehensive. I mean, he came to me with a huge package of information and x-rays and all type of things, because he, really wanted me to understand what he was experiencing. And he was just unsure what he was going to be able to do. So that fear is huge. And that fear is also, like we say, another way of being trapped from an emotional standpoint from taking action. But we want to, do things safely, do things smart, and make sure we're taking appropriate action to get in better shape. What's going on? Ann, hey, Rod, I found you. Thanks for joining, guys. It sounds good, really small on my phone, but we'll watch tomorrow. Yeah, so I'm just checking over here on the other side, see if there's any questions on Instagram. Feel free to put any questions you guys have in the comments about back pain, something or any pain you're experiencing. So it was pretty cool. What do you guys think of the new format today? It's a little bit different. So we were streaming on YouTube and Instagram at the same time, which is cool. I really want to do a better job of being able to trying to show some of these concepts that I talk about. And next time we'll get a few more images up and make it a little bit more lively. But for first time out, it was great. I'm always appreciate all of you for joining and spending your time with me. I know you guys could be anywhere. And I really like the resistance exercises. One feels results for sure. Resistance training is where it's at. Us trainers need to get. We need to get. I just do out there because we really working hard, helping a lot of people do things. One of my clients tells me one of the reasons she likes personal training. She had, in addition to her physical therapist, is oftentimes with the physical therapy due to insurance and things like that, they're unable to work on the entire body. So that's why it's great to work in conjunction sometimes with a trainer and a therapist, or a chiropractor and a therapist, because we can piggyback off of each other. So I can take some of the things the therapist is working on and also enhance that, because if they can only work on the shoulder due to, insurance or, what have you, I can then take that and show how it connects to the hip and how it connects to the cervical spine, and how that translates to the feet. So being able to work on those entire functional movements like that is a really great way to uncover what's really going on within your body. So, and that's what Tim and I have been able to do. And it's been really fun. It's really fun. I enjoy that type of training in addition to doing, some bodybuilding training as well. So let me check on Instagram one more time, see if we have any comments over there. If we don't, we'll get ready to call it, man. Thank you guys for joining today. We'll be back. What's going on next week? Oh yeah, next week is traveling. I'm traveling to Georgia next week. I think we fly out Wednesday morning at about 10 o'clock. We're heading off to Georgia for the Under Armour tournament. That's going to be awesome. It's my son Jared is playing on the Under Armour team, Idaho Premier. And thanks to all you guys who sponsor him this year. But yeah, so that's going to be awesome. So you're as good, if not better. Well, thanks, Denise. So yeah, it's over on YouTube also. So I have to make sure I put that out. I think it may show up a little bit better on YouTube. Let me pull the whole thing up. Yeah, so I pulled the whole. So this may show up a little bit better on YouTube with the widescreen. I have to check the format and see, maybe get everyone to move over to YouTube. But yeah, so that's going to be an awesome trip to Georgia, and then the following weekend we'll be in Chicago. So I'll be gone for about 2 weeks, like 12 days. So it's going to be a lot of fun. Thanks, Denise. Safe travels. I hope you're doing great over there in the heat. I know it's hot over there. Hurricanes are going on over in Florida. Be safe. Try to stay dry. It looks like last time I checked, I don't think it's gonna come your way, though, Denise. What's going on with you, Ann? Anything going on with your workouts? I know we've been talking quite a bit. How's everything going with that? Cool. It looks like comments coming in slow. So we can, I think I could put these on the screen, but no one's asking any questions. Well, thanks guys for being here. And hopefully you guys found that information useful, talking about back pain. Again, making sure if you are doing physical therapy and you're not getting any relief, or if you're doing any type of stretching or anything and not getting relief, make sure you talk to your physician and see if he can get you in touch with someone who may be able to get you going with that emotional awareness and expressive therapy, as well as the cognitive-based therapy, because it looks like these things in conjunction with the physical modalities like yoga, resistance training, and functional training are going to be the recipe for success for all of you out there. So hopefully you found this useful. I just wanted to bring some information that can help enhance what you're already doing, as well as if you're not doing it, add it to your regimen. So as always, the motto is to move, inspire, and transform. Hopefully this information inspire you to get moving a little bit more and a little bit move a little bit smarter with your workouts. Go out there and inspire someone to do something great, and let's transform lives. I'll probably see you guys on live 2 weeks from now. We'll see how we're doing. I think I'll be in the air next week, as I mentioned. So have a great week, and we'll see you guys next time.